All right, so we're here, and I had a friend that called up today, and he is from Colorado, so obviously 5 states away. I can't get him into the office to work, and he says, Chad, I've got an Achilles tendon problem. How do I fix it? Well, I can't have him come to my office, so I'm going to try to give you some at-home stuff. Normally in our office, when you come in here, we go through a hierarchy of what's going on. So I can do a diagnosis, I can take you through a history exam, and that kind of dictates our treatment, how we go. Something like this, it's a buddy of mine, he's a trail running guy, and he says, my Achilles hurts, I got to hit it with the napalm. So we're going to come at it from all different angles and see if he's got some stuff that he can do at home. We've got recently a bunch of new little tricks and tools that we've been using, so I'm going to show you that stuff and we're going to go through it. So I've got my volunteer Sam here. She is going to represent my Achilles tendon, and we're going to try to get it fixed out. So typically with Achilles tendon, you got a couple things that are going on. You've either increased your mileage, or you've increased your speed, or you've got a direct injury like my buddy Mitch falls down the hill and he's trying to catch himself, so he's got an Achilles strain. So you got one of those three things going on. What we want to do is try to release it. Now Achilles tendon, if you can lay it face down please, runs on the back side of the ankle here, and it gets real thick and strong here. So the first thing you do is make sure that thing is pliable and has got a little bit of motion and that it's not completely torn or hanging by a thread. If you can pass that part, then I'm cool with you doing at-home treatment. What we want to try to do is get the tendons take a long time to respond, right? Tendon stuff doesn't have a lot of blood supply, it doesn't heal up really fast, so we want to kind of hack the system. Muscles take minutes to days to fix up. We can get these things going really fast. These take like months, so let's deal with this, but let's really try to get a big change by working the muscles. So the muscle that works as Achilles is your soleus and gastroc, collectively just called the calf. So you want to get in here and just make sure the calves aren't super tight, and you can work them out. You may have to get a friend to help with some of that stuff, or you can do it yourself. One of the tools that we've been really liking is these tack balls that are part of Jill Miller's new book that's out, and she's got an instant bestseller. I was a little skeptical at first. We've been loving these things, so I'm going to show you how you can use these at home yourself. If you're doing it with a friend, I mean, obviously you just kind of work the thing out, but that's not going to work if you're trying to work the backside. So we'll get to this, but we're coming back. These are called massage balls or yoga tune-up balls. Her book's great. We're going to use a voodoo band to start. And on the voodoo band, you want to put a real lot of compression on here and get this thing almost tourniquet tight. I wrap it towards the heart. And Sam will tell you that cuts off some blood supply a little bit. That's the whole idea. We're going to put her in a little bit of flexion, and we're going to work out that Achilles. Now what we're doing is we're trying to take all these surfaces, like the underside of the Achilles and different muscles that come through here. You've got some tib muscles, you've got peroneus, it kind of gets in that area, and we're just trying to unglue stuff. So we get that in there real tight and strong, and then she's got 3 minutes of treatments that she can do on this thing. These are nice, they're cheap, you can take them with you, you can wrap them in a bag. She's going to start with motion. So in our office, we always do 3 stages of motion, and we go through it twice. So she's going to go motion. Sam works for me, she does this for a living, and she knows that I like to spell the alphabet out. I think a lot of times in therapies and chiropractic offices, you get just straight up and down, or you get just side to side. Well, the human body never does that. And if you're working on a trail run thing, you're going up and down hill, never works. So we like to put it through the alphabet because it just puts in all kinds of weird motions. The next thing we do is some sort of resistance. So stand up. I think for resistance on the ankle, that one of the best things you can do is a squat type motion. So she's going to show her perfect squat, and then she's going to come up onto her tiptoes. So she's getting a really big motion in there. So she'll do this for about a minute. She's going to get the squat and the motion. She's just getting it going. There's nothing radical happening here, but at least she's got some body weight resistance. And then her last minute is going to be sport specificity, or how the injury happened. So I would tell her to go for a little run with that thing wrapped up there for 45 seconds to a minute. Yeah, if you're at home, that's how you do it. You're just going to do some basic motion like that. Then you pop this voodoo band off, and we're going to get a huge blood surge happening inside there, and hopefully clean up all those little nicks and cuts and scratches that are causing it. So she'd go through the same 3 motions. Pop back up on the chair, start doing some motion. Doesn't matter how she does it, spell out the ABCs, great. Second minute, she's gonna be doing the squats again. And the third minute, she's gonna be doing the running, because now we're forcing that blood supply. And you can see even on Sam, she doesn't have an issue, and she's still getting tons of blood supply rushing in there. It's a really good way to kind of hack the system and super speed it up. Another thing I really like on the muscle stuff, again, is these voodoo bands, or the tack balls, the massage balls. So go ahead and come down on the mat. We're going to keep them in the little bag here, and she's going to start by working out the muscle. So Sam can get in here and just kind of work it out. She's doing like what's a basic screening right now, finding any little hot spots. Now, she's not really going down to the Achilles area that's painful. Like I said, we're going down there and just kind of hacking. We'll get there. But if she screens out that calf and gastroc and finds a spot that's really tight, we want to go through 3 steps of release. So her first step is a direct compression. So let's pretend you have a spot. She's got compression right there. She's going to turn her body onto that and put a direct compression. We're trying to break up trigger points. That takes anywhere from about 30 seconds to maybe 2 minutes to really get a release. And you'll feel it. It'll feel like melted salts and they just kind of dissolve. Then she's going to start some shearing action, right? So now you're using the ball to create a shear and kind of pushing and pulling. The ball is acting like a massage tool and it's going up and down. This is where I think the foam rollers got really popular in a lot of these balls. Don't just roll back and forth on these things aimlessly. It's not going to help. You have to go through these different steps to get the thing to release. Just rolling by itself, you're missing a big part of it. The last phase, or the third thing she would do, is pin it. So she's pushing the muscle directly against the bone. She may need some help here with a little pressure, and now she's going to start moving the joint above and below. So now the ball's stable and you're making that muscle go before there. And she doesn't even have an Achilles issue, and there's all kinds of stuff happening there with her. She's got creaking and popping and moving, so definitely as a former softball player and cheerleader, she's got some ankle stuff that we need to work on and get it going. Really good way to work. I always like to at least do the joint above and below, and I would probably have her spelling out the alphabet because I like it a little more. Let's see if you can bend your knee with that thing compressed. You know, yeah, so she can get in there and do some basic movement, and you can feel a ton doing that too, right? Mm-hmm. So if you're trying to figure out like what to do with these things, at least do the joint above and below. But it never gets old saying in our office, just play with the balls a little bit and figure out what works. That's always fun to say. It always keeps it fresh. The other problem that happens in the Achilles is a lot of times you've been running faster or you're running longer and this calf muscle is getting overdeveloped. What's happening on these front muscles is the ratio is now getting thrown off. These are getting stronger and shorter. These are getting elongated and stretched out. So you need to do something to build these back. Again, I love the balls. Sam, flip it over, show them how you would do. So what we're doing on these balls now is we go through those same three stages. You're going to screen it, and then if you find something that's going to be a compression, it's going to be the shear forces, and then you're going to have the pin and stretch. But the other thing is you're just making your brain aware of this. There's more proprioception happening because you're getting in there and forcing your brain to pay attention to this. All right? So you would work those things out. And then for corrective exercise, the last thing I would do at home, go ahead and stand up, Sam. We would assume that your calf muscle is shorter and tighter, especially if there's an injury in the Achilles, and that these front anterior tib muscles are longer and weaker. So your rehab is going to be strengthening the front muscles. So what I would tell Sam is every day, add some toe walks, right? These are tiny little muscles. They respond very fast. You don't need a 45-pound plate. I would have her do 10 steps with the toes straight, 10 steps with the toes out wide, and 10 steps with the toes in, forcing all these different directions. What I tell most of my athletes is put a rubber band or a hair tie in your toothbrush, and that way you'll remember to do it every single day. This isn't something that has to be 100 times a day, but it should at least be once a day, and it should be continuous till this thing gets better. Running and stuff is going to be based on your own personal preference and how you can go. I won't try to set any personal records, but you can fix an Achilles on your own. It just takes homework and it takes some diligence. It's not one of those once every 2 weeks I'm going to pop into a chiropractor's or PT and expect a huge result. There's your Achilles tendon treatment.